Okay, so today we're going deep on AI in healthcare,
Sounds good.
which is something that we've been seeing a lot about recently everywhere you look.
Yeah, it seems like it's really blown up, hasn't it?
It really has. And, you sent us this article, AI in healthcare, saving lives or replacing doctors.
Hmm.
And it's got us thinking.
Yeah, it's a really interesting question, isn't it?
It is. And I have to say, even just reading the headline, it sounds pretty intense.
Yeah, definitely thought-provoking.
So I guess the main question we want to try and answer in this deep dive is, will AI be this miracle cure,
Yeah.
saving tons of lives, or is it going to put all the doctors out of a job?
Well, let's hope not the latter.
Yeah, exactly. Like we need our doctors.
Right.
They're-
But yeah, I mean, I think this article lays out the potential benefits and, the concerns really well.
Definitely. And to be honest, some of the stuff this article talks about is like straight out of science fiction.
Oh, yeah, totally agree.
It's crazy. Like they were talking about this AI that looks at retinal scans and it can predict if you're going to get diabetic retinopathy years before there are even any symptoms.
That's incredible.
Yeah, and I mean, that's just one example. They talk about all these ways that AI can do like early diagnoses for all kinds of diseases.
Early diagnosis is huge for any condition, but yeah, especially for chronic diseases.
Totally. And then on top of that, the article mentions that AI can even help to personalize treatments.
Oh, yeah, like figuring out what will work best for each individual person based on like their genes and their lifestyle.
Exactly. And I mean, imagine getting treatment that's literally designed just for you.
Yeah, that's got to improve your chances of getting better.
For sure, but it's not all about diagnoses either.
Ugh.
The article also talks about how AI is being used to develop drugs.
Oh, really?
Yeah, like way faster than before.
So, like, could we actually find cures for diseases that we haven't been able to cure so far?
That's what they're saying. And this article specifically mentioned convolutional neural networks.
Mm-hmm.
And I guess those are a type of AI that are really good at analyzing images and stuff.
Mm.
And apparently they can use those to analyze all this like complex biological data, and it helps them develop drugs way faster.
It's crazy to think how much potential there is in this field.
It is, but it's not all sunshine and roses, is it?
Well, no, I mean, every new technology comes with its challenges, right?
Exactly. And this article definitely didn't shy away from some of the worries that people have about AI in healthcare.
Yeah, like what if the robots take over?
Okay, well, maybe not that extreme, but there are some real concerns.
Oh, for sure.
Like what about all the doctors and nurses if AI is doing all the diagnosing and treating?
Yeah, that's a big one, isn't it? Like, are all the healthcare professionals going to be out of a job?
It's a real concern, and
Oh.
I mean, the article didn't pretend to have all the answers.
Of course not. It's a complex issue.
But it did make this interesting point about shifting our perspective.
Oh, how so?
Well, instead of thinking about AI as like replacing doctors, maybe we should think about it as a tool to help them do their jobs even better.
I see what you mean.
Like AI can do all the repetitive tasks and analyze tons of data and spot patterns that humans might miss.
That makes sense.
And then that frees up the doctors to do what they're really good at,
Right.
like connecting with patients and providing support and making those tough decisions.
Yeah, the things that require human intuition and empathy.
Right. So it's more about AI and doctors working together rather than competing with each other.
Collaboration, not competition.
Exactly.
I like that.
Me too. And I feel like that's a much more positive way to think about it.
Definitely. But I do think there's a need to proceed with caution.
Oh, absolutely.
Oh,
We can't just throw AI into the healthcare system and hope for the best,
you need to be really careful about how we implement it.
right? Like having a clear plan
Right.
and evaluating it constantly and being transparent about everything.
Yeah, all of that is super important.
So I guess the big question now is, how do we make sure that AI in healthcare is used ethically and responsibly?
Yeah, how do we get all the benefits and avoid the risks?
That's a tough question.
There's no easy answer, and honestly, it's something that we need to figure out together.
As a society.
Exactly. Like, we need input from everyone: doctors, patients, ethicists, policymakers, and the tech people developing the AI.
It's a big conversation.
It is, and it's an important one.
So to sum it all up, we've seen that AI has this huge potential to revolutionize healthcare.
It can lead to faster diagnoses, personalized treatments, and even faster drug discovery.
But we also have to think about the potential downsides, like job displacement, and making sure we're implementing AI responsibly.
The key takeaway here is that the future of AI in healthcare isn't set in stone.
Right, it's up to us to decide what that future looks like.
Will it be a force for good, or will it cause more problems than it solves?
It's a choice we have to make.
And one that we need to make carefully.
Absolutely. And that brings us to our final thought for you today.
All right, let's hear it.
As we move forward with AI in healthcare, what role do you want to see it play in your own healthcare journey?
That's a good one.
It's something to think about.
It definitely is.
Thanks for joining us for this deep dive,
My pleasure.
and we'll see you next time.
See you then.
Bye.
Bye.